Hi, my name is Danny. I'm the nurse practitioner student doing your examination today. Can you tell me your name?
I'm Heather. McRae. I'm 38.
And how would you like me to address you today?
Oh, Heather's fine.
Heather, why don't you tell me what brings you in today?
Well, I had a headache since morning, like about 10 hours. It started about 9 a.m. and it became really severe quickly. Yeah.
Okay. So it came on quickly. Like how would you say how fast did it come on?
Just like started right away. I had coffee and then I don't know.
Would you say it came on? What duration would you say? A couple minutes, an hour?
I can't really remember now.
Have you ever had a headache like this before?
No, once or twice each month in the last 2 days. It can last for up to 2 days. As a teenager, I had headaches like this. But it's been more debilitating recently. But I've never seen a healthcare provider for this problem.
Okay. Started as a kid.
Yeah, I've had it in my teens. Yeah.
And they were once or twice a month, but they're getting more severe when they come on now.
Yeah.
Okay. So when prior to this, when was the last time you've had one?
Maybe like a month or 2 ago. Yeah.
Okay. It's been about 10 hours now. Can you tell me a little bit about the quality of the pain? How would you describe it?
It's like a throbbing headache. It's worse behind my right eye. It's super severe. And I feel like I'm and like it's so bright.
Feel like you're gonna throw up. Did you throw up at all today? Feel like it's very bright. Has anything else happened around pain? Any numbness or tingling? Have you seen any lights?
No, but it began really like here and spread to my eye, and now it's everywhere. Yeah, it's all over my head. And it's just like the sharp throbbing pain. Really, the sharp throbbing pain is right behind the eye. But it's painful. Right.
No, I mean, my family members pretty healthy, and my dad has hypertension, and my mom has memory. That's why.
If you had to rate this pain on a scale, 0 is no pain at all, and 10 is the worst pain that you can imagine, what number would you give the pain?
Definitely like an 8 out of 10.
8 out of 10. And has that changed at all throughout the time?
No better, no worse over the past few hours.
So, has anything made it worse today?
Any bright light, noises, or movement.
Has anything made it better for you?
Going to sleep in a quiet, dark room really is the only thing that's been working for me. No over-the-counter medications for pain have helped.
Have you tried taking something over the counter? What have you tried taking?
Tylenol, 1,000 milligrams, and ibuprofen, 200 milligrams.
In the past, have you ever taken this for headaches?
Yeah, and those have been okay in the past.
problem might be. What brought you in for this problem today?
It just feels so much worse than usual, but also like really in them. So, and the nausea's been awful. So I think it's just, I just need to get to the bottom of it.
And how is it affecting your daily life?
Well, I had to send my daughter to my mom's house because I couldn't take care of her today. And then I just haven't been able to do anything.
Just to recap, so you've had headaches in the past, 1 to 2 every couple of months. But today it's much worse in severity, and you're having nausea today that you haven't had necessarily in the past. Okay. And you've tried Tylenol, you've tried ibuprofen, and they haven't really done anything for you today except for laying down in a quiet room. Okay. All right. I'm going to go through what's called a review of systems. I'm just going to ask you some questions. You can just say yes or no if you've had any of these symptoms. Okay. So, have you had fever, chills, or fatigue?
Maybe just fatigue.
Any decrease in your appetite or changes in your weight?
No changes, but yeah, I think the nausea just today.
Okay. Any sweating at night or any weakness or feeling run down? Any rashes or itching anywhere on your body? Any breaks in your skin or bruising anywhere? Any changes in any moles or anything on your skin that you know? And any hair or nail changes? Any other changes to your vision or pain in your eyes? Any discharge or itching in your eyes? And you notice any increased tears or seeing any lights or speckles in your eyes?
No, just that.
Have you noticed any pain in your ears or any discharge from your ears? Any ringing in your ears or dizziness? And any changes in what you're able to hear? Have you noticed any runny noses or drainage from your nose?
No, I mean, I get seasonal allergies, so that's kind of the thing that I'm getting over now.
Do you have any history of sinus infection? Any toothaches or sore gums or bleeding gums? Any change in your taste? Any pain in your neck or swelling in your neck? I'm going to ask you some questions about your menstrual cycle. Okay. How old were you when you first got your menstrual cycle? And at what age did your migraine start? How many days does your cycle usually last?
Well, the weird thing is I haven't really started to really get my period anymore.
Okay.
Yeah, but before it was maybe 5 to 6.
Okay. And when was so? Do you never get your? Okay. So you don't know the last day of your.
It was like over a year ago.
Okay. Any pain or itching in your vaginal area, anything like that? Okay. And when was your last PAP?
About a year ago.
Any pain in your muscle or your joints? Any swelling or limited motion or stiffness in your joints? Any history of fractures? Any history of arthritis?
No.
So any numbness or tingling anywhere? Any loss of consciousness or fainting? Any difficulty moving or weakness in your muscles? Do you have any history of seizures?
No.
Any memory loss? Any anxiety or depression? Any difficulty sleeping? Changes in your sleeping pattern? Any change in your daily stress?
No, I mean,
And do you feel safe at home? Any changes in your safety? I'm going to ask you just some past medical history, get to know your day to day a little bit better, okay? Do you have any history of childhood health concerns or surgeries? Any head trauma, any concussions as a kid playing sports, anything like that? Okay. We talked about you kind of had headaches come on as a teenager. Any recent medical issues as an adult?
none. No, I'm pretty healthy today.
Okay.
Yeah.
Any head trauma at all? Motor vehicle accident, whiplash, anything like that? Any small bump to the head? No. Any history of cancer or cancer treatments?
Not for me,
Any history of diabetes, autoimmune disease, arthritis, lupus, anything like that? Okay. And ever been exposed to or diagnosed with HIV? Do you have any allergies to environment or food? You said seasonal allergies.
Yeah.
Have you ever noticed that when your seasonal allergies come on, your headaches get worse or better? Or? Okay. Any drug allergies? Any food allergies? Do you currently take any medications that are prescribed by a doctor or provider? Okay. And then over the counter, we talked about your Tylenol, your ibuprofen. Are you taking those on a regular basis?
No, just when I start feeling like
Okay. So how often would you say you have to take those? Okay.
Yeah.
Any other medications that you take that you buy at the store? Okay. Any supplements? What vitamins? No. Okay. Have you had a flu shot this year? Okay. Have you ever had a meningitis shot? You haven't. So you mentioned that you don't have any history of cancer. Does your family have any history of cancer?
No.
Any family history of migraines or autoimmune disease?
Mom has migraines on a monthly basis, and I think my brother does as well. And my brother and my dad both have hypertension.
But there are other and your mother and father are both still alive? Okay, and how old are they? And do they have any other health concerns?
Not that I know of.
So I'm just going to ask you a little bit about hobbies and habits at home. In terms of diet, you mentioned that you drink some caffeine. How often do you drink caffeine?
Actually don't think I drink a lot of coffee. But I do have a glass of wine like once every 6 months. However, I had two last night when I wanted to my
Oh, okay.
really kind of wild night.
Um, and coffee not that often, but this morning you did.
I did do coffee this morning.
Okay.
Yeah, just to see if
Okay. But normally not a big caffeine drinker. Okay. Do you drink water on a regular basis? Yeah.
yeah.
Okay. How much water would you say glass wise?
Like a couple gallons full per day. I don't know how big those are really. Yeah, they get used to.
And in terms of what you eat on a 24-hour basis, how many times a day do you eat?
Maybe 4 times.
Okay.
Yeah. Nibble in the freezer.
Or do you have any food intolerances?
I can't eat. No, I like meat.
Okay. Um, how about sleep?
I sleep okay. Yeah.
Okay.
Yeah. Like
Okay.
at least 6 to 7 hours per night.
Is that uninterrupted, or do you find yourself waking?
Definitely interrupted.
Interrupted.
Yeah.
Is that because you can't stay asleep, or is something interrupting you?
My dog.
Your dog.
Oh my
Okay.
god. And my story.
Okay. Have you ever used tobacco? Do you use tobacco?
No, I never have. No.
And any recreational drug use? Cocaine or any drugs? Amphetamines? No. Any past use?
My dad would call it.
Okay.
But nothing current.
Okay. And what did you use in college? And, how long ago did you quit?
Oh, that was 15 years ago.
So have you ever been in the military? And you mentioned school. Did you complete your degree? Okay. Are you currently in an occupation or?
Excuse me. I believe I'm a stay-at-home mom. Oh, and I do blog.
Great. What's your blog about?
Just about how hard it is.
Yeah.
Yeah.
Stressful. Do you have any concerns about health insurance or about paying for your visit today? Okay. In terms of activity, do you have any forms of exercise that you enjoy, or what's your daily activity?
I'm active. I like running, and yeah, I push my daughter.
Did you ever play any sports that involve hitting the ball with your head or hitting into other people? Have you done any travel? No. Anything in the last 6 months to a year? Nothing. Okay. All right. Well, unless you have anything else, you have any questions about anything?
No, I don't.
Well, we will move on to the physical examination. So I am just going to start with some questions for you just to assess. We ask these questions to assess general cognition. So, if can you tell me who the president is right now? Yes. And who was the president in the early 90s? Yeah. Yeah. Can you spell the word world backwards?
ELRO.
And can you tell me what you would do if you smelled smoke? Right. So that's just an assessment of her recall, past and present memory, and rational, logical thoughts. So, I'm gonna start with examination of your head, your eyes, your nose, your ears. I'm gonna do some assessment of the sensory and those sorts of things. So I'm first just looking at hair distribution, looking at skin, and then looking at the ears, looking for a bad sign, infestation, any sort of rash or lesions. And then I'm gonna raise this bed up just a little bit. When you wake up in the morning, you smell coffee in the morning. Okay, assessing for olfactory, just historically. So, starting with cranial nerve 2 optic. So I'm just going to be looking at the pupillary response, looking for direct consensual restriction, consensual. I'm going to have you take a look at this pen here, the tip, and then I'm going to have you look off at the distance. And as she looks close, she can strike some of the way. She dilates, that's accommodation. I'm also going to be here. I'm going to look at the health of the back of your eye. So I'm just going to be touching your forehead here, assessing with the same eye, finding the red reflex, and then coming in. Right, coming around to the other side. And both disc margins are clear. Cup to disc ratio is 2:1. You see no sign of hemorrhage or bleeding, no papilledema. Disc color is orange peach color, and no sign of baby nicking. So next, I'm going to assess cranial nerve 3. Ocular motor cranial nerve 4, trochlear and cranial nerve 6, abducens. So I'm going to be looking at just the movement of your eye muscles. So just follow this. Try not to move your head for me. Finding eye stigmas. You see none. So. Further assess optic acuity. I'm going to have you hold this about right here and have you cover one eye and just read for me the smallest line you can. That's 2020, and then what's your other eye?
3, 6, 7.
So that's 2020 in both eyes. You were corrective lenses. Okay. So that's a continuous optic cranial nerve too. So now I'm going to be assessing cranial nerve 5, which is trigeminal. So that's kind of sharp and dull. Okay. So first I'm going to test sensory. So just close your eyes and let me know what you feel here. I'm going to have you open and close your jaw. Good. And she does have some clicking. Do you have any pain or tenderness there? Okay. I'm just going to have some temples here. Any pain or tenderness there? And now I'm going to do the cranial nerve, move on to cranial nerve 7, which is facial. So I'm going to have you smile really big for me and frown and show me your teeth. Good. And now squint your eyes closed. Don't let me open them. Okay. Open your eyes really wide. Good. And then I'm going to have you pull out your cheeks. Don't let me push the air out. Good. Okay. So facial cranial nerve 7 is intact. Next, we're going to do auditory cranial nerve 8, which is acoustic. So I'm going to stand over here. I'm going to have you plug your ear on this side, and I'm going to whisper 3 numbers and letters, and have you tell me what you hear. Good. Now we're going to do the same on the other side. Yep. Good job. So that whisper test was negative. So if it were positive, I could do the rhymes, and the Weber test would be just looking for lateralization on the top of the head and looking for bone conduction versus air conduction. She has fine hearing, so I won't be doing those tests today. So then I will be looking at cranial nerves 9, 10, and 12. So I'm going to have you open your mouth here for me and say, ah, good. And so looking at cranial nerve 10 for vagus, uvula rises midline, looking at the palate rising up and falling appropriately and equally. Can you stick your tongue out for me? Move it back and forth. Good. And so that's cranial nerve 12, hypoglossal. And any changes in your taste? Okay. And any difficulty swallowing? And that's cranial nerve 9, esophageal. So finally, I'm going to assess cranial nerve 11. Go ahead and shrug your shoulders for me. That's spinal accessory. Good strength. I'm going to have you turn your head against my hands there. Good. And that's assessing trapezius muscle strength and sternocleidomastoid strength, which is 5 out of 5 both sides. So I'm going to quick take a look inside your ears and your nose just to make sure everything is healthy. I'm going to sit down next to you here and look inside your ears. I'm going to come around to the other side.
Okay, so I see that there's no any discharge damage.
And bilateral eardrum are intact. Bony landmarks are present with a good cone of light. I don't see any sign of perforation or bulging, a little bit of cerumen, but no signs of lesions, drainage, or masses in the ear. And I'm just going to have you tilt your head back up for me. You can look inside your nose. I don't see any sign of massive lesions, no septal deviation or perforation, inferior turbinates, pink and moist. Next, we're going to do some strength testing. So I'm going to start with your arms. I'm going to look at your hands here. I'm going to have you squeeze. Good. And then I'm going to have you make. Good. And don't let me pull through. Good. And I'm going to have you spread your fingers out. Don't let me close your fingers. Okay. And then you can close your fingers and push out against me. Good. Good. And then I'm going to have you pull up against my arms. Good. And then push down. Strength throughout there is 5 out of 5 against resistance. And then I'm going to do some strength testing in your legs. So I'm going to have you push up against me. Good. And then I'm going to have you push down against my hands. Good. Good. Okay. And I'm going to push out against my hands. Good. And back against my hands. Okay. So that's testing hip flexor, quadricep, hamstring, and yeah, gluteal strength, which are all intact. I'm going to have you push down against my hands, good, and pull up against my hands. And with your big toes, push up against my hands and down against my hands. Good. Okay. We're going to do some sensation testing now. So you're going to feel this. Why don't you tell me when it's gone?
Gone.
Okay. And then I'm going to test your feet. Here. I'm going to hand you something, and I want you to close your eyes and tell me what it is. Okay. Yeah, good job. Okay, and that's testing for stereogenesis. And then I'm going to write something, a number on your hand towards you, and I want you to tell me what it is. Good job. And that's graph field. And then I'm going to touch you with either 1 point or 2, okay? And I want you to tell me what you feel. Close your eyes. Okay, I'm going to do your feet now. Good. Okay. I'm going to have you do a few tests of your cerebellar function, so looking at coordination. So first I'm just going to have you take your heel, and I want you to run it from your knee down the front of your shin on each side. Good. Good. Now I'm going to have you take your hands, and I want you to place them on your thigh, and you're going to do this, and then flip them back, and you're doing it as fast as you can. Great. Okay. Very good. Now I'm going to have you take your finger to your nose, and then you're going to go from there to where my finger is, back and forth, okay? And my finger is going to move, so you can do a practice. There you go. Okay, ready? Good. Okay. So cerebellar movement is intact, function is smooth and clean, no jerkiness and no lack of coordination there. So now I'm going to do some deep tendon reflexes. Okay. So I'm going to start with your brachial. Brachial. So try and relax. I'm going to do your biceps. You can just rest your arms. Just try and relax in my hand as best you can. Okay. So that's 2 plus in the triceps and 1 plus in the biceps. Two plus. Okay, and 2 plus in the Achilles. So now I'm going to have you get up, stand for me, and we're going to do some walking. Okay. So I'm going to have you walk. You can just walk like you regularly walk. Okay, and coming back, I want you to walk on your tiptoes. Okay. Good. And with walk, I'm looking for any unequal gait. And going back, I want you to walk on your heels. Any abnormal swing of the arms, any shuffling or foot drop. And then on your way back, I want you to walk on tandem, so one foot in front of the other, yeah, heel to toe. Any unequal balance. Can you turn Dellenberg walking? Okay, wonderful. So finally, I'm going to have you lay for me not going to check abdominal reflexes. So far, her neurological exam has been completely normal, and it's not present in about 30% of patients. So I will check her Babinski response. So good. Can I get it? So I'm going to have you lift your head up for me. Good. You see with that? And now I'm going to lift your head for Babinski. And no hip or knee flexion. Okay. And then I'm gonna lift your legs and just bend here and then looking for pain signs of pain. Any pain here? Okay. We're gonna do the same on the other side. Any pain? Okay, great. Alrighty. And you can sit up now. Actually, you know, I'm gonna have you stand up. We forgot one thing. I'm gonna have you stand and close your eyes for me. I'm looking for any unusual sway, any equilibrium or balance issues. Okay, and now I'm going to have you put your arms out for me with your palms up. Okay, close your eyes again. And I'm looking for any drifting of the arms. Now I'm just going to tap on your arms, and you just do what's natural for you. Okay. And she's negative for protonator drift and Robert. So you can go ahead and rest. All right. I think that completes our neurological exam. Do you have any questions?